Welcome to the Erbium Laser Training course for clinicians. In this session, we will cover the fundamental principles of erbium lasers, their applications in dermatology and aesthetics, and important safety protocols to ensure effective and safe treatment outcomes. We'll also explore two key erbium laser wavelengths, the 2,940 nanometers and 1,550 nanometers. As this type of laser can cause potential injury to patients, it is important to exercise restraint and caution when setting the parameters. In addition, perform a spot test prior will allow you to treat better and help manage comfort of your patients. Before watching this video, make sure that you have received your laser safety training as a prerequisite to watching this video. Thank you. Now let us get started. Key definitions and vocabulary used in this training. Above is a list of words associated and used in this training. Make sure to familiarize yourself, you will be quizzed. What is an erbium laser with a 1,550 nanometer wavelength? Is a type of laser commonly used in dermatology and cosmetic treatments, designed to target water in the skin. In clinician terms, this wavelength effectively penetrates the skin to stimulate collagen production, making it ideal for skin resurfacing and treating wrinkles, scars, and texture issues without causing significant damage to the outer layer. With its infrared wavelength that can deeply penetrate into the dermis, stimulating collagen production for skin rejuvenation with minimal disruption to the skin's surface. This specific wavelength is non-ablative, meaning it does not remove the outer layer of skin, so it's gentler with less downtime. It's mainly used for skin tightening, treating wrinkles, and scars. Patients usually experience mild redness or swelling, but can return to daily activities quickly within hours after receiving treatment. In some cases, some minor peeling may occur, comparable to a minor sunburn. What is an erbium laser with a 2,940 nanometer wavelength? Is highly absorbed by water in the skin and targets the outermost layers, making it better suited for precise skin resurfacing. It targets and vaporizes the outer layer of the skin, also known as the epidermis, which makes it ideal for removing fine lines, deep wrinkles, and severe scars, but it also requires more recovery time. Patients need more healing time since the outer skin is removed, but the results are often more dramatic. Contraindications. Patients with herpes simplex, cold sores, bacterial, fungal, or viral infections in the treatment area are prohibited from receiving this treatment as it can trigger or cause an outbreak. Eczema, psoriasis, or dermatitis can worsen with laser treatment. Erbium laser treatments are typically avoided during pregnancy and breastfeeding due to the lack of studies on safety during these periods. Patients with recent sunburns, tanning, natural or artificial, or sun exposure within the past 2-4 weeks are at higher risk of complications like hyperpigmentation. Medications like Accutane, isotretinoin, antibiotics, or certain birth control pills can make the skin more sensitive to light and increase the risk of burns or adverse reactions. Patients prone to developing keloids, raised scars, should avoid aggressive treatments like ablative lasers, as it can increase the risk of scarring. Conditions like HIV, autoimmune disorders, or patients undergoing immunosuppressive treatments may have delayed healing and a higher risk of infection. Caution is advised in patients with a history of skin cancer or suspicious lesions in the treatment area. Diabetes, hypertension, or other uncontrolled chronic conditions that affect wound healing can increase the risk of complications. Recent laser or chemical treatments. If a patient has recently undergone other laser treatments, chemical peels, or dermabrasion in the same area, the skin may be more vulnerable and should be allowed to fully heal before proceeding. Severe rosacea or hyperpigmentation issues. Conditions that cause hypersensitivity in the skin, like severe rosacea or melasma, can be exacerbated by laser treatment. Careful patient assessment and consultation are essential to avoid complications and ensure the safety of the procedure. After being treated with the erbium laser, downtimes is expected with the 1550 nanometer, offering faster recovery compared to the 2940 nanometer wavelength. To be specific, downtime is greater with the 2940 nm wavelength, typically lasts within 5 to 10 days with noticeable redness, swelling, and peeling as the outer skin layers heal. It requires more recovery time due to its ablative nature, but results are more dramatic. The 1550 nanometer wavelength offers a faster recovery time, typically between 1 to 3 days, with mild redness and swelling. It is non-ablative, so healing is quicker, allowing patients to return to normal activities within a day or two. Results are more gradual over multiple treatments. Cooling is very important when using erbium lasers, as it helps protect the skin, minimize discomfort, and reduce the risk of thermal injury or burns. Cooling during laser treatments can also improve patient comfort by numbing the treated area, minimize side effects such as redness, swelling, and potential blistering, enhance safety by lowering the risk of overheating the skin during more aggressive or high-energy treatments. Post-treatment recommendations. For optimal results, this must be followed and adhered to. 1. Cool and moisturize the skin, using cold compress or chiller device if available. 2. Avoid direct sunlight and use broad-spectrum sunscreen SPF 30 or higher. 3. Avoid scrubbing or exfoliating. Let skin heal naturally, without picking. Use of gentle cleansing with non-irritating, fragrance-free products is highly recommended. 4. Avoid makeup and harsh products per 5-14 days, depending on treatment intensity. 5. Manage discomfort with pain relievers like acetaminophen, avoiding aspirin. 7. Follow up with your clinician for progress checks. 8. Avoid exercise and heat for 24-48 hours post-treatment. Here are key tips for setting parameters and assessing patient reactions during Erbium YAG laser treatments. 1. Start with low settings and gradually adjust based on skin response. 2. Consider skin type. Darker skin requires lower energy to avoid hyperpigmentation. 3. Monitor skin reactions. Look for redness, swelling, and frosting, adjusting if reactions are excessive. 4. Ensure patient comfort. Regularly check on pain levels and use cooling between passes. 5. Avoid overheating. Stop treatment if blistering or excessive redness occurs. 6. Adjust for sensitive areas. Use lower settings for delicate areas like around the eyes. 7. Use higher energy for deep scars or wrinkles, lower for superficial issues. In conclusion, Erbium YAG lasers are powerful tools for skin resurfacing and rejuvenation, offering both ablative, 2940 nanometers, and non-ablative, 1550 nanometers, options to address a wide range of skin concerns, from fine lines to deep scars. Successful treatment requires a deep understanding of laser settings, patient skin types, and careful attention to skin reactions during the procedure. By following key post-treatment care and adhering to safety protocols, clinicians can achieve excellent results while minimizing risks. Always prioritize patient comfort, use appropriate cooling, and tailor the approach to each individual's needs. And now let's get to treating. Always practice safety and exercise wise clinical judgment. Ultimately, the balance of precision, safety, and patient-specific adjustments will lead to optimal outcomes and patient satisfaction. With the right knowledge and approach, Erbium YAG laser treatments can be a cornerstone of effective skincare and aesthetic enhancement.